So I would like to welcome now Sarah Badbell. Sarah is a midwife from the UK. She is also a licensed acupuncturist. She has a big experience in teaching um, acupuncture and acupressure for helping with the pregnancy, delivery, etc. So thank you, Sarah, for giving time and for being here with us. It will be lovely to hear your lecture.
Thank you. Thank you, Yanni. Efaristopoli for the invitation. Speaking to you from the UK. I will just see if I can share my screen. So bear with me a minute, please. So can you see my PowerPoint? Yeah? Okay, thank you, thank you. So yes, as Yanni said, I'm background in nursing and midwifery and trained in acupuncture in London and China in the 1980s, so a long time ago. And I'd like to share with you today some of my experience of using acupuncture in obstetrics. So I first became interested to offer women more choice of pain relief in labour, and hadn't really realised how amazing acupuncture could be for all the other things that can happen in pregnancy. So I started up a service in a hospital, in a national health service, which means the patients don't have to pay for their treatment, in the southwest of England, which is where I live and where I'm talking from now. It started in 1988 and it closed, sadly, in about 2012 when I retired from the hospital. But over the years, we treated roughly 8,000 women, and that was myself alongside two other midwife colleagues you can see in the picture there, who were also traditional Chinese medicine trained acupuncture midwives. This was a unique service in the UK. So sorry to say that it's not common to find such a service at the moment, but it was a fantastic privilege to be able to do this. So I'd just like to give you a little overview. Lately, I'm more teaching acupuncture. I have a very small clinical practice, which is only dedicated to obstetric patients. But I've just been to Cambodia, where I had the privilege to work for an NGO charity. We went in February, and my job was to teach a group of 17 midwives in acupressure. They're not allowed to do needling, but also 3 doctors who work on the lake clinic, serving a very poor population in the floating villages. And I was able to teach the doctors. I only had a week with them, sadly, but managed to teach them things like the NADA protocol, using ear needles, which is fantastic for PTSD, post-traumatic stress. And they felt it would be very valuable for their patients. So that was a wonderful experience, which I hope to repeat. Well, here we all are in this awful pandemic, and we've all had to try and find ways of supporting our patients, and I guess it's different in different countries. But when we were in the lockdown, we were lucky to get support from different people providing resources and tips and tricks to serve our patients. And these were some of the people that were sharing information, which we were very grateful for. And the Royal College of Obstetricians and Gynecologists in the UK were putting out advice. It's had a huge effect, of course, on women having their babies. In the UK, the birthing partner or patient's husband cannot go in until the patient is in well-established labour. And even things like having ultrasound scans are being affected by having their partner with them. And I find this terribly sad. And I know that the women are struggling with this. So for myself, I've been supporting patients over Zoom. And actually, because of the convenience, I've found that it's, in some ways, has been better in terms of contact time, because particularly postnatally, when the woman's got her baby, getting up to your clinic is a bit of a, bit of a nightmare with a new baby. But I've been checking in with patients on Zoom postnatally and supporting breastfeeding problems, etc. I've been teaching acupressure for pain relief in labour to patients' husbands over Zoom. And, I think we can still offer an awful lot. Some of my colleagues are seeing patients again in full PPE, but I know this is different in different places. So it's a difficult time, but there are still things we can do. So let's move on to obstetrics. Thank you very much for that fascinating talk from the classics. I can't do anything like the justice you've just done to it, but just to mention briefly, it's dating back, I think one of the main authors, as far as I understand it, was Sun Miao in 652, who wrote a lot on gynecology. And the focus really was on dietary advice, lifestyle and behavior advice, and development of the fetus. I owe a debt of gratitude to Zhubin, who has written a lot on obstetrics and gynecology from the classics and done an enormous amount of translation. There are some other books available, which I recommend if you're interested. So they would focus on things like advice, her sleeping place must be peaceful and quiet. They advised what she should eat and drink. And it's really almost like poetry when you read through the classics on advice through the 9 months of pregnancy. I haven't got time to go into too much detail, unfortunately, on this. Of course, a massive question is acupuncture safe in pregnancy? It's something that concerns a lot of people. Caroline Smith did a study on nausea and vomiting with 593 women. And as an adjunct to that study, they looked back on miscarriage and adverse incidents. And they found that there were no differences between the study groups for pregnancy complications. And then further studies, not related to obstetrics, but in general on acupuncture, you can see here that the adverse events were extremely low. And then there's a more recent study which was published from Korea in 2019. So we do have some evidence that acupuncture is a safe treatment, but of course we have to say in the right hands and with well-trained practitioners. And for myself, I think it's also important to consider the so-called forbidden points. Again, I don't have time to go into that now, but it's something that we do have to consider. So what's different when we're treating pregnant women? Well, when we're teaching acupuncture students, we have to tell them about things like position. We don't want pregnant women lying flat on their back because of postural hypertension. So positioning is very important. We have to have a well-ventilated room if they've got nausea and vomiting, because otherwise they might throw up, and having balls and tissues available. We try not to leave the patient alone, or if we have to, we have a means for them to call us. And we think about the needling technique. In my experience, pregnant women don't need strong reducing technique for most conditions. And so those sorts of considerations should be taken into account. And then we have to think about the frequency of treatment. I don't think it's much use seeing somebody with severe vomiting once a week. You really need to see these women every 2 or 3 days if possible. And if that's not practical, then we can support them with perhaps ear press needles or ear seeds in between treatments so that they can support themselves. We advise the students on referring some of the red flag, or all the red flags. So just to talk about some of the conditions briefly, I'm not going to go into how to treat them, but just this was one of the most common things we saw. Of course, it's a very common problem, and the patients were very grateful when we could help them with their nausea and vomiting. This was Dawn. This was her fourth baby, and she was still breastfeeding her 3-year-old son. And when I did her traditional Chinese medicine diagnosis, she had a picture of blood deficiency, which I felt was related to the breastfeeding, which TCM consumes blood. And I advised her to stop the breastfeeding and gave her a treatment, and she did very well. This was so hyperemesis gravidarum. This is my great passion. It's a very difficult condition. I hope none of you have had it or been related to somebody who's had it. It's difficult because they're spending so much time in hospital, and pregnant women don't really like to take drugs if they can avoid it. And thalidomide, of course, was such a disaster, and is still in many people's minds. So we found fantastic results with hyperemesis. I'm not going to use the word cure, but we certainly supported them, and we found that their admissions to hospital were negated or certainly reduced. The hyperemesis didn't completely go away, but with good support, we were managing to give them a much better quality of pregnancy. They were able to stay at home with their families, and although they might still be a bit sick, it certainly wasn't taking over their lives and causing dehydration. The great passion for me was, I think the worst case was a girl called Kerry, who had hyperemesis from 7 weeks and was repeatedly admitted to hospital for intravenous infusion. Her weight got down to 6 stone, which I think is roughly 38 kilos. And she was so ill that they were considering terminating the pregnancy. Excuse me. She came to the clinic, and you can see the change was instant. We managed to get really good results, and she was at home much more. When I was on holiday and my colleagues couldn't manage to see her very quickly, she actually went downhill again and had to go back into hospital. So it really did look as though we were managing to keep her out when we could treat her. And she did really well and was extremely grateful, and she actually felt that it saved the life of her baby. So this one highlights to me the importance of frequent treatment, and also you know, I do feel that this kind of treatment should be available in the hospital system, because when people are being asked to pay for treatment frequently in our country, a lot of them can't afford it because they're used to the national health system and don't have health insurance. When we look at the research behind hyperemesis, I felt so strongly about acupuncture being available that I actually decided to do a master's and focus on hyperemesis. So this was just a few years ago. And at that time, there were 3 randomized controlled trials, one by Carlson, which is old now, it's 2000. The next was by Habeck in 2004, and the third was by Neary in 2005. They were all RCTs looking specifically at acupuncture, but all had different methodologies, so it was hard to compare them. They were in English, but it wasn't the first language of any of the authors, so there were some translation issues. Studies 1 and 2 only used Neiguan pericardium 6 on all the study participants, and study 3 used Neiguan, Zhongguan, Zhusan Li. And does this reflect what we do in our clinics? No, it doesn't, because hopefully we're doing individualized treatments and tailoring the treatment to the patient in front of us. So I decided to see if we could do something about trying to get a picture of what was really going on out in clinical practice with a view to designing better studies. So I consulted the Oracle, and I did for my dissertation a modified Delphi consensus study, which was finished in 2018 for my MSc. It was a 3-round Delphi, and the aim was to find out what experienced practitioners felt was the best approach to treating HG or hyperemesis gravidarum with acupuncture, and to see if they could reach consensus. So I had 19 international acupuncturists from 6 countries, and I knew some of them because the obstetric acupuncture world is not that big. But to reduce bias, I also recruited from professional organisations. They had to be English speaking, practice TCM style acupuncture, 5 years in practice, and treated at least 5 cases. So I used SurveyMonkey and used a 7-point Likert scale and asked their views on points used, as well as other treatment considerations, such as safety and frequency. I had 100% response rate from the first 2 rounds and 95% from the third, so I was really pleased with that. And they achieved consensus on all but 2 of the questions, which related to some of the points. And so this information can inform clinical practice, which particularly is useful, I think, for less experienced or newly qualified practitioners. And also, more importantly, that I would like to see that the results used to design more robust research studies in the future, based on the outcome. Okay, so moving on to some more conditions. Here's an example of using ear seeds to support a patient. This was a patient with Barrett's esophagus, which causes severe heartburn. She had this pre-pregnancy, but during pregnancy, she had to come off all her medications. So she was desperate and was sent to see me by her GP. And I used all the usual treatments that I would use for heartburn, and tailoring them to her particular clinical picture. And I helped a little bit, but really not enough. And then just one day I thought, well, I'm going to probe around her ears and see if there's something else that we can do to support her. And I found the esophagus point, which is the one just below the root of the helix there. And it was dramatic. It was absolutely fantastic. And although I had to carry on seeing her every week, she said that that point made a huge difference to her condition. So sometimes we have to sort of think a bit more widely and get creative with our treatments. And I find that ear acupuncture can be a great support patients to press the points in between treatments. Pelvic pain, or symphysis pubis diastasis, pelvic girdle pain, it's now more commonly known as. Another huge waiting list for our clinic, very common in pregnancy. This is Lisa. She had it from 10 weeks, and she had it so badly, she couldn't even bend down to put her own pants on. She's 23 weeks here. Sadly, we had a long waiting list and we couldn't see the patients very quickly. But you can see that she also had crutches because she couldn't walk without them. She was wearing an obstetric support belt, and she was also having physiotherapy. But after 3 acupuncture treatments, you can see her needles there, I think, just about, she no longer needed her crutches. So that was a great result. And that would be fairly typical. There she is lying prone to use the points on the back of her leg. And this was a special cushion that we had made, but it's very expensive. But pregnant women love lying on their tummies because they can't normally do it. So this has a great big hole where the baby is. This is a cheaper version. It's called a holo, and it was designed by a mother who wanted to lie on her tummy when she was heavily pregnant. And this is very popular as well. Varicose veins, fairly common in pregnancy. This was the worst case I've seen. This was Alison. She was a primary school teacher, so she spent a lot of her day standing or crouching on those little children's chairs. And it's her 4th baby. There was a strong family history, which is often the way with varicose veins. And although we couldn't you can't make them go away. Unfortunately, acupuncture isn't that magical, but you can certainly do an awful lot to help the aching and throbbing. And it was difficult to needle these legs, as you can imagine, but it did help her tremendously. But it was another case of having to see her every week to support her. Normally, this pain and throbbing would just get worse and worse, as you can imagine, as the pregnancy advances. Breech presentation, this is fairly well known in terms of obstetric acupuncture, and we use moxa, Artemisia vulgaris, to the point Ji Yin, bladder 67, both sides for 15 minutes, ideally from 34 weeks. Much before that, the baby's still moving around too much, and you don't really want to try too late because there's not so much for the baby to turn, room for the baby to turn. But our aim, of course, is to avoid a difficult breech birth or cesarean section. This was in China, and when I was there in Nanjing in 1988, the women were just sitting in the corridor with their moxa sticks by their toes. I don't think we kind of get away with that here. But the success rate, looking at the research studies, of which there are a decent number now actually, they show about 60%, and that's the same with us. We treated hundreds of cases of breech presentation, and they were mostly coming out at about 60%. If you look at spontaneous version, which has been looked at in studies, it's around 40% between 34 weeks and term. So in other words, we're getting 20% more babies round with moxibustion, and that has big implications for cesarean section rates and also cost implications. And a midwife in Holland called Ineke van den Berg has done a very comprehensive economic evaluation of the impact that moxibustion for breech could have against cesarean section costs. It's quite an interesting paper. I think one of the important things about moxibustion for breech is that the women, we show them what to do and they take the moxa sticks home and do it themselves. So it's empowering. They feel that they can do something for themselves. And this was what we did in Cambodia. When I was mentioned earlier, when I was there in February, this is a young prima gravida, and these are two of the midwives I was teaching, and they're using moxibustion to try and get her baby round. And at home, people have various ways of doing it. People are cutting a potato in half and putting the moxa stick in, and all sorts of things are being used. Play-Doh at the bottom. People seem to find a way. This is a story of a first baby at 36 weeks. And in the UK at this time, all women having their first baby with breech had to have a cesarean section. So she was referred for moxa and went home and did her treatments twice a day from Monday to Friday, because she was seeing the consultant at the end of the week for cesarean section date. They had smoke detectors in their house, so they used to do the moxa in the garage. But on Thursday night, the day before her clinic appointment, her husband was late home. So she used the Black & Decker Workmate, which I've put a picture of there. She clamped the moxa sticks in and put her feet up on a stool underneath. And the baby turned that night. And she came to see me on the labour ward the next day and was very happy because she avoided her cesarean. So even if you haven't got somebody to do it for you, you may be able to find a way. I did a pilot study for a bachelor's back in the 80s, early 90s. And I looked at 10 women with breech at around 34 weeks. And we did the abdominal cardiotocograph recording, monitoring the baby's heartbeat and fetal movements and any contraction activity. And we did an abdominal ultrasound scan before, during, and after to see if we could demonstrate the difference. And we did show that there was increased fetal activity and therefore raised fetal heart rate activity. So there's definitely a connection that goes on. And this could be replicated into an interesting and much larger study. And it would be interesting to look at other measurements such as maternal cortisol levels, which have been shown in some animal studies to be changed by moxibustion. But something happens, even with a compromised fetus. This was a lady having her 13th baby, 13th, and she was referred because she had reduced fetal movements, and she was having daily or every other day CTG recordings of her baby's heartbeat, and they found that the baby was breech at 36 weeks. So although she'd had 12 normal deliveries, because of it was being breech, because of having had so many babies, she would have to have a cesarean. So I started doing Moxa to bladder 67 daily, and the baby turned after 3 treatments. She had a normal delivery, which was fantastic, but the baby was very floppy, and actually he had Down syndrome. So Down syndromes with poor muscle tone, what we call a compromised fetus here, even a baby like that responded to Moxa, and I think that's absolutely fascinating. And of course, it's a great outcome for her because she really didn't want a cesarean section. Something else that we can help with is premature labour, and some points that we use, and points to support. I'm going to hurry up a little bit now. And the rationale for kidney 9 is that it's a point that can help calm the uterus. Pain relief in labour, that's how it all started for me. And I used to use ear points with electro-stimulation. I'm going to whiz, Yanni, because I see I've got a few minutes left. But we've moved into using acupressure much more. We teach the patient's partners how to do this because they're available for the birth. And we also teach midwives how to do this because an acupuncturist isn't always available. And DVD's been made by Deborah Betts in New Zealand. My patients are being interviewed on there. And there's also an app. Excuse me, speeding up. This is one of the Cambodian midwives proudly showing me a picture of a patient that she'd used acupressure on the night before. Postnatal recovery we can do a lot for. There's a technique called mother warming. This is to help build up chi and blood again after the birth, of course, which is very depleted. And this is something that patients absolutely love. It's done 4 to 5 days after the birth because the first few days are days of elimination rather than tonification. And lots of advice, of course, on a good diet. We did an audit using MyMop, which is a scoring system, whizzing, and we had clinically significant changes in our scores of 2, over 2, and actually a change in score of 1 is considered clinically significant. So we were very pleased with that. In terms of support organisations, there are quite a few in obstetric acupuncture, and particularly the MAMPS programme, which is Maternity Acupuncture Mentoring and Peer Support. This is myself, Deborah Betts, Claudia Sikovitz, Zena Coker, and Dr. Kate Levitt, all very experienced obstetric acupuncturists, and information can be found on Deborah Betts's website. We have journal clubs, we look at research, and we do modules, teaching and mentoring students. The obstetrics OBAA organisation has members who are particularly interested in obstetrics. And again, we support with roundtable discussions and research updates, etc. I've whizzed through this, but if you're interested in learning more, we have a weekend workshop in Athens, which I'm really looking forward to. And that's going to be in April next year, 17th and 18th. And for more information, you can go to the website or email, and there's the addresses there. And myself and Laura Dana will be doing one day on acupressure, which is particularly useful for midwives. And I'm going to be doing a day on acupuncture, which would be a much more expanded version of what I very quickly galloped through just now. Thank you very much for listening, and please don't hesitate to contact me if I can be of any further help. Thank you. Ευχαριστώ πολύ.
Thank you very much, Sarah. That was a great lecture. It will be very nice to meet you in person here in Athens on April. Now